ministers here present, guest ministers, host ministers, the regional director of WHO Africa, members of the diplomatic corps and the heads of international agencies, senior government officials, distinguished invited guests, ladies and gentlemen. A very good morning to you all. On behalf of His Excellency Paul Kagame, the President of the Republic of Rwanda, it is my great pleasure to join you today at this official opening of the first WHO Africa Health Forum that is taking place here in Kigali Convention Center. The government of Rwanda wishes to extend its warmly welcome to all our esteemed guests. Soyez tous les bienvenus au Rwanda. Please feel most welcome to Kigali. We trust that alongside of your two-day forum, you will have an opportunity to visit other beautiful and touristic parts of our country and enjoy the Rwandan traditional hospitality. The government of Rwanda most sincerely thanks WHO for having chosen Rwanda to host this important Africa Health Forum. This is yet another proof that WHO recognizes Rwanda's efforts aiming at improving our health standards and providing an efficient and productive workforce in this sector. Excellencies, distinguished guests, the theme of this Kigali Africa Health Forum is putting people first, the road to universal health coverage in Africa. This theme is very, very important. It is a good opportunity to advise African countries, African governments, on how to efficiently improve health security, progress towards equity and universal health coverage, and the unfinished agenda of communicable diseases. In so doing, this forum will be in line with the implementation of one of the 17 Sustainable Development Goals, SDG 3, that concerns good health and well-being. This goal calls on countries to ensure healthy lives and promote well-being for all at all ages. The road to universal health coverage in Africa is also number one of the priorities of Dr. Tedros Adhanom Ghebreyesus, the newly elected Director General of WHO, the ever African elected Director General of WHO. He pointed out, I quote, "All roads should lead to universal health coverage. I will not rest until we have met this," end of quote. Healthy lives for all Africans is also one of the main targets of the Agenda 2063, the Africa we want. In this agenda, African people will have a high standard of living and quality of life, sound health and well-being. Being healthy, as His Excellency President Paul Kagame, the President of the Republic of Rwanda once said, I quote, Being healthy is the basis for all socioeconomic development, and without it, nothing can work. End of quote. For this reason, African countries must work together and learn from each other through sharing experiences. This will certainly translate the 2063 dream of good health and well-being into reality. Coming back to the theme of this forum, putting people first, the road to universal health coverage in Africa, I would like to share with you what Rwanda has so far achieved. Since 1994, after the genocide against the Tutsi in Rwanda, the health system undertook several reforms. Rwanda set up innovative solutions, such as Ubudehe, a homegrown solution, one of them, which assigns health support to our people according to their socioeconomic status. Our country is now advancing towards universal health coverage for the basic health needs for our people. There are some other examples of innovations in the health sector in Rwanda. Another example is Mutuelle de Santé, our community-based health insurance scheme, as well as the government subsidization of healthcare services, such as malaria treatment. These culminating innovative efforts are helping us to ensure equitable access to health services throughout the country for our population. But the population has to contribute, and they do it. Rwanda achieved the Health Millennium Development Goals, gaining recognition on a global scale for this achievement, and you continue to push forward to achieve the health sector sustainable development goals and other goals of SDGs. These efforts have now made Rwanda as one of the few African countries with more than 90% coverage for immunization and access to critical health services, including TB treatment and access to ARVs for HIV patients. We are confident and very highly committed to share this exciting experience in health sector services with all of our sisters and brothers from Africa. Mutuelle de Santé, community-based health insurance scheme, was established in Rwanda in 2004 as a national policy to meet the needs of Rwandans who did not have other health insurance schemes. Mutuelle de Santé, as of now, covers 84.6% of the entire Rwandan population, or the part of health insurance coverage. This is from the formal sector, public sector, and the private formal sector. Using these achievements as a foundation, we are currently building upon these national comprehensive frameworks, looking forward to the next 30 years. Actually, we are now developing our Vision 2050. And we are preparing the third Economy Development and Poverty Reduction Strategy, EDPRS 3, both of which will aim at transforming our country into an upper middle income country by 2035 and into a high income country by 2050. As far as the universal health coverage is concerned, the sustainable partnership with the World Health Organization, WHO, and other esteemed partners will continue to play a key role in a policy design, financial resource mobilization, and programs implementation. Honorable Ministers, the Regional Director of WHO Africa, Excellencies, distinguished guests, ladies and gentlemen. I would also like to call upon our fellow African countries to set up strategies that will help them and all of us to implement the resolutions from this forum. I also request all health stakeholders in Africa and beyond to support Africa's efforts in this regard and to ensure that such efforts are aligned to national aspirations and priorities. And finally, I call upon the private sector, the vibrant private sector of Africa. We want to invest more and more in the health sector. In conclusion, I once again wish to thank WHO and its partners, our partners, for having successfully organized this forum and for having selected Rwanda as a host country. I also thank all participants to this health forum. Rwanda is looking forward to receiving and implementing the recommendations from your deliberations. With these remarks, Excellencies, distinguished guests, ladies and gentlemen, on behalf of His Excellency Paul Kagame, the President of the Republic of Rwanda, to declare the first WHO Africa Health Forum that is taking place here in Kigali officially open. Thank you for your attention. God bless you.